I am Walimbo Ali. I am a senior health planner here. This is Ministry of Health, and in the Department of Planning, we had a 10-year health financing strategy that runs from 2010 to 2025. And this strategy guides the whole sector and its partners in terms of how we finance health services in Uganda.
My name is George Tamale, and I'm the Executive Director of the Private Sector $1 Initiative. The $1 Initiative is a campaign that was started by the private sector, leading private sector organizations, to mobilize additional resources for health, and that is HIV/AIDS, TB and malaria, but starting with HIV and AIDS.
My name is Ali Kaviri, and I'm the team leader at the Youth Equality Center. We are a youth-led organization, and we are amplifying youth voices on gender equality and social justice. Civil society in Uganda has largely played a key role in terms of advocating for increased funding towards the health sector by pushing the 15% Abuja Declaration. Civil society has largely contributed towards research.
In terms of progress, we've progressed well because we've been able to implement most of the interventions that we planned. One of them is performance-based financing as one of the additional ways of financing services. And as we talk now, we've covered the whole country in terms of scaling up that based financing. 2, we plan to have an AIDS trust fund, which as we talk now, we already have a legal framework and now working on the implementation. We also planned to have another major intervention as introducing National Health Insurance Scheme, which also, as we talk, by 2019-2020 financial year, we had gone past the cabinet, parliament, and right now I think we're expecting to hear the second reading in parliament for that to be passed. So the last one that we had in the health financing strategy that we thought would have was a basket funding, which we are trying to pursue, where we would have all stakeholders putting resources in one basket, then we're able to distribute.
If you look at issues around reproductive health, Uganda, we are confronted with several challenges regarding access to reproductive health, both in terms of information and services. Many young people that we work with are the sidelines of, receiving information and services. So there is a very big gap around that. And as an organization, Youth Equality Center, we've done a lot of analysis from a youth lens and also showing how government can be able to increase funding towards reproductive health of young people.
You know that health is also competing for the same resources with other sectors, education, infrastructure, energy, and the rest, defense. One of the things that we would want our colleagues in the civil society to do is to make a case that whereas we need education, we need works, but we also need to make sure that health is key.
So as civil society, what we can do is to ensure that we make our voices, loud and clear. We do analysis and share findings to show that UHC, or the National Health Insurance as a package within UHC, has a ripple-down effect on communities, on the lives of women, on the lives of youth.
Financing the health sector requires a lot of money. We have to mobilize every Ugandan to come and support. Now, initiatives like the $1 Initiative and other initiatives would be key in ensuring that we help government mobilize more money. The challenges can be removed by a contribution from everyone.
What COVID has done at the moment has largely exposed our health sector even with a few cases, you see that our health sector has been overstretched. So this is a call to government to prioritize our health sector. So for me, I laud especially the government in terms of taking very strong steps in ensuring that already we have a roadmap towards UHC. We have made strides in terms of even having discussions around, concretizing issues around universal health coverage.
Certain things are ongoing, like we are trying to make sure that we develop a framework for identifying people who are unable to pay. Second is accreditation of providers, so we're working with the private sector and also our colleagues in the civil society to make sure that there's a system of private facilities to improve their services, but also develop a framework for accrediting, making sure that you can qualify to competently provide services under NHIS or NHIF. We're also doing infrastructure. If you move around, you will see that there's upgrades of health facilities so that there is a spread of these facilities wherever they are, but also focusing on the referral system. We also move towards making sure that we're efficient in terms of service delivery, because if you cannot expand your basket, then you need to be efficient so that you survive within the available resources.
If we CSOs can only talk about some of these things without really the real beneficiaries of some of these well-intentioned programs, without that kind of support from the community, then our voices cannot be solid. And that's why that for us as Youth Equality Center and partners such as Public Health Ambassadors, we are teaming together to mobilize the youth, for example, to make their voices heard towards UHC. We are doing studies to ensure that we share this kind of materials with policymakers to make informed decisions while making budget allocations, so that most of these decisions are from an informative point of view rather than emotions or politics.
Overall, as of 2020, we've moved up to maybe 80% of our health financing strategy.